is what people are talking about at the moment following the tabling of the NHI bill. Let's now get some clarity on the proposed funding model. There are reports that health practitioners are not happy about the model, with concerns that many doctors may leave the country as a result. Let's chat some more with Health Department Deputy Director General Anban Pillay. He's in our Pretoria studios for us. Anban, a very good evening to you. And I'm sure you've heard about all the concerns that have come out over the past couple of days since you spoke about the NHI, and the latest, and I'm just going to go to what the DA has said. They're the latest to comment on this. Lots of concerns. The first one being that this is just going to be another SOE. The general feeling is that it's going to be open to corruption.
Good evening, Rebecca, and good evening to the viewers. Yes, so I've seen that from the DA. I think the DA doesn't quite understand what the National Health Insurance Fund is. It's classified as what's referred to as a Section 3A public entity. There are about 180 Section 3A public entities in the country. In fact, even the Western Cape, which the DA governs, has 6 or 7 Section 3A public entities. So public entities don't have the same flexibilities to take risk and autonomy on financing that your Eskom or your SAA has, which I think they were quoting as being a problem. So the National Health Insurance Fund doesn't have those kinds of flexibilities. It is a large fund that basically buys health services on behalf of all South Africans. So it's not intended to take the kind of risks that you would anticipate in a state-owned enterprise, is what a SOE is, and it's not an SOE.
The other concerns are about the referral system, Anban, and the feeling here is that this will jeopardize healthcare. It will jeopardize access to specialists because you would not be able to choose where you go. If you actually need a specialist, that will be up to the doctor, to the nurse on duty if you're going to a clinic. And the feeling out there is that, you know, emergency cases where urgent attention is needed, that those will be jeopardized.
Yes, I also saw that, and I think there's a bit of a misunderstanding about how the system works. The DA argues that the hospitals will be reporting to the national government, which is not true. The hospitals in the bill very clearly states they will be autonomous units, which means that they will be operating independently of national or provincial government as autonomous units. Globally, the best model for hospitals to function are having a significant area of autonomy so they're able to deliver services. The referral systems have been in place in South Africa for many years, and they'll continue to be in place. In many other countries as well, they have referral systems with independent hospitals operating. So I don't really see the problem with people accessing specialist care through a referral system using that model.
Unfortunately, Anban, we wouldn't have time to go through every single one, but the general feeling, and we spoke to the South African Private Practitioners Forum last night as well, also saying they're wondering about where the money is going to come from this. The DA is saying, of course, this is going to be an additional tax burden. It's going to be a tax squeeze on ordinary South Africans as well. And also that private practitioners are going to be driven out of the country because they're not going to be able to live on what they will make because of this plan. Just your response to that.
I think there's a lack of understanding about how the financing would happen. But I mean, if we just talk about where the money is going to come from, currently South Africa spends about 480 billion rand on healthcare services. We're basically going to be using the total expenditure in the country to provide more effective and efficient healthcare services. I think the SAPPF, for example, have no idea what they're going to be reimbursed. So it's a bit premature to say that you know, they're going to be paid rates which are unreasonable. But even if they were to leave the country, the question is where they're going to go to. All of the other countries that they could potentially go to also have NHI systems. So if you go to the other country, it'll also be regulated in terms of your tariffs. So I'm not quite sure where they would want to go to get access to a better rate.
And very quickly for us, Anban, we are out of time, but I just want to know, seeing as you have all these concerns coming from the very people who are going to have to give off their service, you know, the people who are going to be in the middle of all of this, and I'm not sure how much consultation was done when you did come up with this model as well. Do you think it may be time to just maybe have a proper sit down, because the SAPPF also saying that they've asked for a meeting with the health minister, they want to put their concerns and possibly some solutions down to their concerns. Do you think it's time maybe for you to just thrash all of this out with them and bring some clarity to the process?
Well, the SAPPF is only one organization representing specialist groups. I'm not sure if you had an opportunity to observe the introduction of the bill, but we had many practitioner groups. All of the GP groups were there in full support, including the South African Medical Association. But we would be happy to sit down with the SAPPF. We've sat down with them on many occasions before. I've had over a dozen meetings with them where we understand their position and they understand our position, but we're happy to continue to meet with them and deal with the matters that they raise.
Okay, thanks very much for your time there. Anwin Pillay, he's the Health Department's Deputy Director General, just responding to some of the concerns that have come up over the past couple of days around the NHI bill. Thanks very much for your time.